The operating room fell silent, except for the muffled laughter from the surgical team. "Look who they assigned to assist," the lead surgeon whispered, not bothering to hide his contempt. "The new girl. Bet she's never even held a scalpel properly." They saw a young woman, barely 30, who looked like she belonged in pediatrics, not a high-stakes trauma surgery. What they didn't know was that those same hands had performed life-saving procedures in the back of blacked-out helicopters over Iraq. Her jaw clenched tight underneath the surgical mask. She maintained her gaze downward, concentrating on the careful, nearly ceremonial positioning of her instruments. The hands that had become targets of their ridicule were absolutely unwavering, operating with an efficiency of movement that revealed a profound, nearly instinctive mastery. Dr. Patterson, the trauma surgery chief, murmured to his resident, his tone a deep, patronizing growl that traveled effortlessly throughout the sanitized area. The new girl. From the opposite side of the table, Dr. Hayes, a veteran surgeon known for his caustic wit, snickered. "Hope she doesn't faint when we open him up. This isn't like patching up a scraped knee in the clinic." They perceived exactly what they chose to perceive. A youthful woman, scarcely 30, possessing a reserved manner they confused with timidity. Someone who appeared better suited for pediatrics than the savage high-pressure realm of trauma surgery. What remained invisible to them were the spectres standing at her back, the voiceless, phantom forms of the soldiers she had struggled to rescue. The chaos and grit of a military hospital in Mosul escaped their vision, that location where the atmosphere was dense with the odour of blood and gunpowder, and the sole illumination originated from a solitary swinging light bulb driven by a rattling generator. Unseen were the 8 years she dedicated as a battlefield surgeon, conducting emergency chest operations inside trembling helicopters, her hands unwavering even while the external world was engulfed in flames and brutality. Within this sparkling, immaculate medical facility, she wasn't Major Martinez, the honoured surgeon who'd secured the admiration of battle-hardened troops by dragging them back from death's threshold. She was merely the recent addition, an intruder they could brush aside with careless, thoughtless cruelty. Everything transformed when the patient arrived on the stretcher. The emergency area exploded into an orchestra of managed pandemonium, the morning's tranquility demolished by the pressing actuality of an existence suspended in precarious balance. "Sergeant Daniel Torres, 26 years old, multiple gunshot wounds to the chest and abdomen," a first responder recited rapidly, his tone strained with immediacy as he and his colleague moved the hemorrhaging, senseless figure onto the surgical table. While the crew descended upon the stretcher, slicing away garments, evaluating the harm and shouting vital signs, Emily glimpsed the patient's features and her circulation froze. She recognized that face. She recognized the weathered, tattered identification tags suspended around his throat, the ones she was presently gently raising to position on the instrument holder. This was the warrior who transported 3 injured Army Rangers to protection while experiencing intense gunfire in Mosul. An individual whose understated bravery had transformed into mythology within her squadron. He'd received a Purple Heart for his personal injuries and a Bronze Star for his courage prior to his medical separation. And presently, he was here, hemorrhaging on a stretcher in Boston, 1,000 miles and an existence removed from the conflict that had shaped them both. During the surgical preparation, her thoughts accelerated. The battlefield surgeon inside her assumed control, examining, evaluating the entrance wounds, the trajectory of the projectiles. Something was incorrect. This wasn't a combat injury. This was something different, something nearer, something more intimate. Dr. Lars Patterson positioned himself at the table's head, the unchallenged monarch of his territory. He observed Emily, his gaze frigid and scornful above his mask. "Just try to keep up, Martinez," he stated, his voice saturated with a concluding blast of superiority. Then he created his initial cut. The instant Dr. Patterson's blade contacted the patient's flesh, Sergeant Torres's delicate steadiness disintegrated. the consistent, measured pulse of the cardiac monitor, the life's timekeeper in the surgical chamber, intensified into a wild, shrill warning. The digits on the blood pressure screen started to cascade, a numerical avalanche of approaching demise that transmitted a surge of terror through the chamber. "He's bleeding out faster than we anticipated," Patterson grumbled, his self-assured, nearly performative bearing starting to fragment. Perspiration formed on his temple, a dramatic opposition to the frigid, regulated atmosphere of the surgical chamber. Emily observed from her station as the secondary assistant, her consciousness a frozen, transparent tool of examination. Her educated perception, sharpened by years of executing life or death choices in moments, instantly recognized what the primary surgeon was overlooking. The entrance wound configuration, the bullet's course, the delicate, nearly undetectable manner the patient's thoracic wall shifted with each labored respiration. It was a narrative she'd interpreted 100 occasions previously in the blood and grit of Iraq. Patterson was searching in completely incorrect locations. He was adhering to a manual protocol, an orderly, tidy collection of regulations for an orderly, tidy reality. However, this was not an orderly wound. This was the filthy, tumultuous, volatile actuality of high-speed trauma. From the table's head, the anesthesiologist shouted out, his tone constricted with an anxiety that was rapidly converting to terror. "BP is dropping to 60/40. Heart rate is climbing to 120. We're losing him." "Dr. Patterson," Emily spoke softly, her tone scarcely detectable above the wailing monitors. She advanced nearer to the table, her existence a modest, serene island in an ocean of ascending terror. "The bleeding might be coming from the intercostal vessels. The trajectory suggests—" Patterson erupted, his concentration still submerged in the patient's thorax. He didn't even glance upward. "I didn't ask for your input, Martinez. I've been doing trauma surgery since before you graduated medical school. Hand me a clamp." The remaining surgeons stayed voiceless, their features concealed behind their masks, but Emily could sense their attention on her. They were anticipating her to retreat, to withdraw to her allocated position as the silent, unseen assistant. However, Emily had never been someone to retreat, not when an existence was at risk. She'd acquired her medicine in locations where self-importance was an indulgence nobody could manage, where the solitary thing that mattered was maintaining the patient on the table, breathing for one additional moment, one additional hour. The monitors persisted their pressing, unrelenting alerts. Sergeant Torres was perishing. Patterson murmured, more to himself than to anyone present. His hands, which had appeared so self-assured and unwavering just moments previously, now quivered somewhat as he investigated the wound, his quest becoming more wild, more frantic. "Where is this bleeding coming from?" Emily reached her conclusion. She couldn't remain passive and observe a fellow warrior, a champion, perish because of one individual's arrogance. She advanced nearer to the table, her tone tranquil but resolute, infused with an authority that caused the resident adjacent to her to recoil. "Sir, with respect, we need to explore the posterior chest wall. The angle of entry suggests damage to the vertebral arteries. If we don't find it now, he won't make it." Patterson's tone elevated, a piercing, furious fracture in the tension-saturated chamber. "That's enough, Martinez. You are here to observe and assist, not to play trauma surgeon. Now step back and let me do my job." However, as if conjured by the discord in their voices, Sergeant Torres's eyes abruptly shot open. Their anesthesia was unsuccessful, his body battling through the sedation with the remainder of its power. His eyes flashed around the chamber in frenzied terror, ultimately concentrating on Emily's features above her surgical mask. A burst of acknowledgement, as piercing and transparent as electricity, penetrated through the haze of agony. His hand launched upward, seizing Emily's wrist with a power that was astonishing for an individual who was hemorrhaging to death. Through the breathing tube, he succeeded to compel a noise, a frantic, choked word that everyone in the chamber could comprehend. "Doc Martinez," he wheezed, his tone a mere murmur, but it transported the gravity of complete conviction. "Iraq, she saved us." The complete surgical crew froze. Patterson's hands ceased moving. The chamber descended completely, utterly voiceless, except for the persistent wailing pulse of the monitors. Sergeant Torres's grasp intensified on Emily's wrist, and with a concluding, tremendous exertion, he articulated again, his tone stronger, sharper, a directive from the threshold of death. "Get Dr. Martinez. She knows combat trauma." In that instant, every presumption, every patronizing jest, every scornful look the surgical crew had aimed at the reserved new physician disintegrated into powder. The taunting murmurs perished in their throats. They weren't observing a recent addition. They were observing a battlefield veteran, a surgeon who'd secured her qualifications in the most merciless classroom in existence. Dr. Patterson's features had turned ashen behind his mask. His gaze encountered Emily's throughout the surgical table, and, for the initial occasion, she witnessed something different than superiority. She witnessed dread, and she witnessed the frantic, unvoiced appeal for assistance from an individual who abruptly comprehended that his patient's existence relied on an experience he'd never possessed. "Dr. Martinez," Patterson stated, his tone scarcely above a murmur. "What do you need?" Emily didn't squander a solitary instant on clarifications or self-importance. The monitors displayed Sergeant Torres descending further into hemorrhagic shock, his existence quantified in the wild, measured pulses that were becoming fainter by the instant. Every instant of postponement transported him nearer to the threshold of no reversion. She advanced forward, her military preparation assuming control, a mechanism activating in her consciousness that converted her from a silent assistant into a commanding official in a mass casualty situation. "I need a thoracotomy tray and 2 units of O-negative blood stat," she stated, her tone penetrating through the tension with a rehearsed authority that caused the complete chamber to become attentive. "And someone call the blood bank. We're going to need at least 6 more units on standby. Now move." The surgical crew, which had been immobilized by uncertainty just instants previously, operated with a fresh and frantic intention. The ridicule and uncertainty that had saturated the chamber had dissipated, substituted by the concentrated, nearly wild intensity of a crew that had been provided a fresh, transparent mission. The resident who jested about her collapsing now hurried to obtain the thoracotomy tray, his hands trembling more than hers ever had. "The entry wounds suggest the bullets fragmented after impact," Emily clarified as she operated, her hands shifting with a velocity and exactness that was spectacular to observe. It was a muscular memory constructed in the furnace of battle, a capability refined by conducting these identical procedures underneath the faint illumination of a field tent, with the noise of hostile fire in the distance. In Iraq, we saw this pattern constantly. The primary bleeding isn't from the obvious wounds. It's from the secondary damage caused by bone fragments acting as projectiles inside the chest cavity, Dr. Patterson observed, his preliminary astonishment yielding to an awakening captivation and a deep, expanding admiration. He supported her, transferring her instruments, his movements now respectful, the movements of a pupil viewing a master. Emily's approach was dissimilar to anything he'd ever witnessed. It was efficient, conclusive, and savagely proficient. Every incision, every clamp positioning was precisely where it required to be, with no squandered motion, no wavering. From the periphery of the sanitized area, one of the residents murmured, observing, "Jesus, look at her technique. It's flawless." Emily located the origin of the hemorrhage within moments. It was a severed intercostal artery concealed behind a ragged fragment of rib bone, precisely where she'd anticipated it would be. While she operated to restore the harm, she persisted to instruct, her tone a constant, tranquil existence in the high-pressure drama. In combat medicine, You learn to read the story the wounds tell you, she stated, her fingers shifting with the refined grace of a master craftsman as she stitched the damaged vessel. Civilian trauma often follows predictable patterns, but military trauma is different. High-velocity rounds don't just punch holes. They create cavitation effects, a shock wave that damages tissue far from the apparent injury site. You have to think three-dimensionally. You have to think like the bullet. While Emily managed the hemorrhage, the wild pulsing of the monitors started to decelerate, reverting to a more controllable, life-maintaining rhythm. Sergeant Torres's blood pressure commenced to ascend, shifting from the threshold of demise back toward the domain of the living. The anesthesiologist declared, his tone saturated with a relief that was nearly tangible. His pressure is coming up, 110/70, and climbing. Emily permitted herself a modest, nearly undetectable smile behind her mask. She'd witnessed too many exceptional soldiers perish from injuries that were survivable with the appropriate knowledge and rapid action. Sergeant Torres wasn't going to be among them, not during her supervision. While she commenced to seal the surgical location, she was conscious that the complete crew was observing her every shift, their earlier ridicule substituted by concentrated, nearly worshipful silence. The conversion in the chamber was total. She was no longer the inexperienced recent addition. She was a battlefield veteran, a master of her profession, a surgeon who'd secured her expertise in the most rigorous circumstances conceivable. While they readied to transport Sergeant Torres to the recovery unit, Dr. Patterson spoke. "Dr. Martinez, I owe you an apology. We all do." Emily glanced upward from her concluding stitches, her gaze encountering his throughout the table. "No apology necessary, Doctor," she stated. "We all want the same thing, to save lives. But maybe next time we could skip the assumptions and just focus on the patient." The surgical suite exploded in silent, relieved laughter. However, Emily wasn't concluded. Removing her gloves, she stated, "Actually, there's something else you should know about Sergeant Torres's case. His injuries weren't from enemy fire." The chamber descended silent again, the fresh mystery suspended in the atmosphere. 3 weeks subsequently, the sanitized, silent corridors of Boston General were a reality removed from the tension of that surgical chamber. Emily was executing her morning examinations when she witnessed a recognizable figure in the hospital's physical therapy section. Sergeant Torres was operating with a walker, his movement gradual but constant, his features established with an expression of severe determination that Emily acknowledged all too well. His recuperation had been extraordinary, quicker than anyone had forecasted. However, Emily understood that the discipline and psychological resilience constructed in the military frequently generated results that astonished civilian medical personnel. When he detected her, Sergeant Torres shouted out, a sincere smile extending across his features, "Dr. Martinez, come see how your handiwork is holding up." Emily entered the therapy chamber, a warm sensation of fulfillment washing over her. Torres stated, his tone saturated with an excitement she hadn't detected previously. "The physical therapist says I might be able to go home by the end of the week. First good news I've had in months." Emily concurred, examining his chart on her tablet. "That is good news, Daniel. Your latest imaging shows complete healing. You've been an exemplary patient." Torres paused, his smile diminishing somewhat as he positioned himself down, his expression becoming serious. "Dr. Martinez, Emily, I need to tell you something. When I woke up in that operating room and saw you there, it wasn't just relief, it was hope. For the first time since I got back from Iraq, I felt like maybe things could work out." Emily experienced a recognizable constriction in her thorax, the burden of being someone's lifeline, a responsibility she transported through 100 firefights and 1,000 surgeries. "Daniel, you saved yourself. I just provided the technical expertise," he persisted, glancing downward at his hands. "No, it's more than that. Do you know what I was doing the night I got shot? I was walking to the bridge over the Charles River. I had decided that maybe everyone would be better off if I wasn't around anymore. The admission struck Emily like a physical impact. She'd suspected that Torres's existence at the convenience store hadn't been completely coincidental, but detecting him verify her anxieties caused the successful surgery to feel even more substantial. But then I saw that kid with the gun threatening that old man behind the counter, and something inside me just clicked. For the first time in months, I knew exactly what I needed to do. I wasn't just a broken-down veteran. I was a soldier, and soldiers don't walk away from people in trouble. Their dialogue was disrupted by Dr. Patterson. He approached with a formal document in his hands, his earlier superiority substituted by a warm, professional admiration that had characterized their relationship since that day in the surgical chamber. "Dr. Martinez, I'm glad I found you. The hospital administration has asked me to discuss a permanent position with you, head of trauma surgery, with a focus on developing new protocols for treating combat veterans in civilian medical settings." The proposal captured Emily completely unprepared. She'd been operating on a temporary agreement, substituting while the hospital investigated for a permanent chief. The concept that they not only desired her to remain, but were presenting her a leadership position, was more than she'd ventured to anticipate. Patterson persisted, his tone saturated with a sincere passion she hadn't witnessed previously. "We've seen a significant increase in veteran patients. Your unique background makes you the ideal candidate to lead a specialized program. We want you to train our staff, to teach them what you taught us in that operating room." From his chair, Sergeant Torres was beaming. "Sounds like the hospital finally figured out what the Army knew 8 years ago," he stated. "Dr. Martinez is one hell of a surgeon." While Emily contemplated the proposal, she thought about the taunting murmurs, the scornful looks, the constant draining battle to demonstrate herself. It all appeared like a remote memory presently. This wasn't merely a job, it was a mission, an opportunity to construct something that would assist other veterans like Daniel Torres, to connect the separation